of the more common things that I'm seeing in my practice today is women are more and more inclined to step away from implants, the traditional method of breast augmentation. And many women, as they get older, decide that their priority is feeling better, feeling more comfortable, and oftentimes there's a sense that the breasts are now too large when you're in your 50s as compared to when you're in your 30s. And some sagging has occurred with childbearing, and they want smaller, perkier breasts. So not infrequently, women also are concerned about the long-term requirement for continued maintenance of implants. So a very, very common approach now is to remove implants and do a breast lift and then replace volume using fat grafting. That is a woman's own fat in a convenient place that is troublesome, say like the waist area, and harvesting that fat and then using it for fat grafting. We can't get as much volume with fat as we can with implants. Generally speaking, about 1 cup size is what one should expect for the overall volume enhancement of the breast. But it does eliminate the need for long-term maintenance of implants. It lightens overall the breast because typically implants are larger than 1 cup size. And it becomes a very, very common and satisfactory solution for many patients who are interested in a little smaller, perkier breast.